My name is Maria, and I am the face of Black maternal health. I have an 18-month-old beautiful baby boy. I had a great maternal care team at the group practice that I went to. There were OBs, midwives, nurse practitioners, and other RNs as well that managed my care. They made sure that I was taken care of. They took me seriously. They listened to my concerns and they investigated every part of my pregnancy. I was very closely monitored because I did get diagnosed with high blood pressure prior to pregnancy. So the whole time they kept a very close eye on me.
While not all women, especially Black women, have access to a maternal health team, it is great to see that Maria has been able to find one who listens to her and closely monitored her. It is also positive to see it includes midwives on the healthcare team.
More importantly, the midwives also at least formulate for us an area where there may not be a large abundance of obstetricians. They oftentimes help to care for patients in those maternal care deserts. And this is where the midwives help to bridge those gaps and sort of help to alleviate the burden. And I will say that data has supported the benefit of the use of the midwife, particularly in people of color, specifically Black women, as well as the disenfranchised populations.
Research has shown that midwifery-led care improves healthcare outcomes. That leads to lower rates of C-sections, preterm birth, and anemia. The World Health Organization has identified midwifery as playing an important role in lowering global maternal and newborn mortality.
And I remember sharing with the physicians that I had a very extensive family history of hypertension and stroke. I would go to the doctors and ask all these questions about what should I do to prepare for postpartum? Are there any complications I should be aware of? What about postpartum preeclampsia? Should I be checking my blood pressure? And every time I would raise these questions, they kind of just brushed them off or said, you know, things like that are rare.
If they have certain risk factors, for instance, if they are morbidly obese, if they have a history of cardiac disease, if there's a strong family history of cardiac disease, I'm gonna do my little screening first. They're gonna have an EKG, likely an echo, and if I find something on that and they're asymptomatic, I will refer to the cardiologist.
As soon as I told them that I had high blood pressure, they immediately diagnosed me as a high-risk pregnancy. I was getting care in tandem with a high-risk maternity care team as well. I had double testing for gestational diabetes and consistent testing for preeclampsia to make sure that I didn't become preeclamptic during my pregnancy. They also made sure to manage my blood pressure and my blood pressure medication, and they were the ones that referred me to see a cardiologist as well.
I refer patients to a cardiologist if they have any current or past risk factors for cardiovascular disease. This would include women who have a history of heart disease, such as valve abnormalities, abnormal heartbeat, or what we call arrhythmia, hypertension, diabetes, obesity, a history of preeclampsia, or women who have heart-related complaints in pregnancy, such as chest pain, shortness of breath, difficulty breathing, or an abnormal heartbeat.
The cardiologist will be working with your care team to make sure that they're focusing more importantly on your overall cardiovascular health, not just during that period of time, but also understanding that these conditions could impact you several decades in the future. So this is where the cardiologist would be working with your care team to ensure that those bad outcomes don't lead to future bad outcomes when it comes to your heart health as well.
So the majority of pregnancy heart teams, it's defined as including the cardiologist, the obstetrician, the maternal fetal medicine specialist, the obstetrical anesthesiologist. And it's all in an effort to lessen the morbidity and mortality in moms and the infant. As Association of Black Cardiologists has advocated for, it's more than just that team. It also includes the village, and this village can be mental health experts, midwives, doulas, our church family.
There is a valuable role that Black men, as spouses or even relatives to pregnant women, can play as a part of that collaborative care team.
All of these contributing to the village to make sure that our moms are supported as they go through this pregnancy.